Hello, and welcome back to Senior and Living Today. On today's episode, I would just like to discuss some heart issue signs that we should all be aware of when they come together or separately as something new, as heart disease runs rampant through the United States. We especially have to be concerned about it as seniors. Be aware of what our bodies are doing, what changes are happening. Some of these things I'm going to describe might be normal for you and not out of the ordinary. But when things are out of the ordinary or they're clumped together with other symptoms, we really don't want to let those things go. I think the last 2 years with what's been going on, people have a tendency to neglect going to the doctor as often, or they're doing more video calls with the doctor, or ignoring things a little more, waiting until they can go in and see the physician. And we just don't want you to overlook anything that is or could be important. So, we're going to go over just a few signs and symptoms of things you should be looking out for. And if you come across them or someone you know or care about has these issues, encourage them to go see a provider. So, number one on the list is chest discomfort. Now, some people have chest discomfort uh, often. They have a lot of indigestion. They've always had it. It's normal for them, and you know when it's normal. If it's abnormal for you, do not let that sign go un I don't want to say untreated. Make note of it. Make note of it. So chest discomfort, I would say, is first. Nausea, nausea, heartburn, stomach pain. If that's not a normal thing for you, that is something that you should be addressing with your provider. And depending on the severity, you might not address it with your provider before you address it with emergency room staff. Um, any pain that spreads down your arm, that should be concerning. If you've been out working in the yard and working with your arm and have pain going down your arm, that's one thing. But pain, ache, or pain going down your arm for no explained reason, that should not be left unattended. If you feel dizzy or lightheaded, that could be a chest symptom. That could be a dehydration symptom. It could be a blood sugar symptom. So you want to pay attention to that. If it's unusual for you, think about what you've eaten, what you've had to drink, how hydrated you are, and you may need medical attention for that. If you are experiencing throat or jaw pain, that should not be left unattended. The throat is that, it can be so many things, but in a combination with chest discomfort, that is something that could be serious. If you get exhausted easily, if that's something new for you, that is something that you should bring up with your provider. If you're snoring, if that's new, some people snore all the time, but if it's new, is it new sleep apnea? Is it, are you excessively tired? That's something that you want to make note of because snoring and heart disease have been tied together and you don't want to let that go. Unusual sweating, unusual coughing, those kinds of things. Again, some people are natural sweaters, they sweat all the time. You don't have to worry about that. If that's something new and it's not 80 degrees outside, that is something that you should also make note of. You should be writing symptoms down. If you don't think they're severe enough to go see the provider right away, you should keep a list of symptoms that you're having, when you're having them, so you have a good record to transmit to your provider. Are your legs and your feet sometimes your fingers swollen. Those kinds of things you need to keep track of. Have you been eating a lot of salt, or could this be related to a chest issue? Are you normally swollen? Is this something brand new? Definitely something that you'll want to keep track of. I know when you go to the doctor, they squeeze your ankles and your feet to see how fast um, your blood pools and comes back, and can tell how severe your swelling is. That's something that you want to keep track of and don't want to leave unattended. Last on the list, I would say, but it's not last, is an irregular heartbeat. If you know that you have an irregular heartbeat and you've always had one, that's not alarming. But if you feel like your beat is off and normal from what it's been, what you would consider an irregular heartbeat, that is not something that you want to leave unattended. You do want to see someone about that. So many people are lost every year to different forms of heart disease, and a lot of it is preventable. So you want to be aware of the signs, aware of symptoms, aware of those around you and their health conditions. Talk, share that information, and if you feel like something isn't right, most definitely make an appointment or go to the emergency room, depending on severity, and get some treatment. There are treatments and options, and the best thing you can do is get it looked at right away. So, thank you for listening to me today. I appreciate your time. I hope that you will like this video. I hope you will share this video. I hope it's been helpful to you or to those around you that you share it with. If you have any questions, any topics that you'd like me to discuss, please note them below. Any comments that you make, I will read the comments. I will respond to the comments. And I thank you again for joining me again on Senior and Living Today. Goodbye.